The Bahamas continues to grapple with the aftermath of Hurricane Dorian. That hurricane made landfall as a Category 5 and killed at least 50 people there, but that number is expected to climb dramatically as search and rescue efforts there continue. Officials say there are still some 1,300 people missing. In addition to the widespread destruction, Dorian's destruction is also presenting the Bahamas with a number of public health issues. Joan Kelly is a disaster response manager with Heart to Heart International. It's an organization offering disaster relief in the hard-hit Abaco Islands. Joan, thank you so much for joining us. You just returned to Nassau from the Abaco Islands. You were seeing patients there every day. Could you describe for us what you saw on the ground? From everything we've seen, it sounds like the conditions there are just unbelievable.
Yeah, that's correct. So generally speaking, we are seeing the wave that you would expect after a disaster like this, where individuals are in critical need of continuity of care and their basic needs. And that's what we were really focused on, particularly around healthcare.
How about the biggest public health concerns there right now? Because we know obviously you want to help people who are injured or who need help, but with all of that destruction, with the incredible heat there, I can only imagine that there are growing health concerns about for people in that area.
Yeah, absolutely. So what you see immediately after a disaster is folks that need trauma care. After a couple of days, it turns into treating those chronic conditions because people have lost everything, including their medications. And so we are treating people with hypertension and blood diabetes and reestablishing that care that they would typically have. And then because people are living in conditions where we don't have any running water, electricity, there is sanitation and hygiene concerns. So we do start to see those infectious disease issues, diarrhea, upper respiratory infections, and so on.
Looking back at some of the recent disasters in the Caribbean, cholera killed thousands of people in Haiti after the 2010 earthquake. In Puerto Rico, we know there was the deadly leptospirosis outbreak after Hurricane Maria. Are you worried about those things taking hold in the Bahamas?
I think that this is a very concerted effort here to mitigate those concerns. We responded after both of those crises. And generally speaking, I think as long as folks are working very diligently to mitigate those factors, then it's possible to avoid some of the issues that we see.
Joan, I know you're there to help with medical issues, but on a human level, I know you were probably one of the first people these folks have seen to help them and help them get through this. What has that been like? I imagine it's just so emotional to be dealing with people who have been on the brink of death, and you're there to try to help them survive.
Yeah, I mean, we always see incredibly resilient people. I think a special note of the women that have really stepped up, and we're working with a woman that used to manage a resort, and she's basically now taken over a distribution site. You just see person after person doing whatever they can to help one another, and I think that that's really heartening.
All right, Joan, thanks so much.
Thank you.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.